Great, good morning everyone, and welcome to the first of a series of member webinars relating to the 2019 COVID-19 pandemic. I see we're quite a few online today, so thank you so much for joining us wherever you are in the world. As we mentioned in several of our communications over the past few days, we've decided to organise these webinars to kind of provide you with a platform online to share your stories, your resources, your experiences, recommendations, etc. We've had incredible feedback from Professor Huali's presentation. I know that you're online, Huali, so thank you so much. This has just proven how important it is to share information, and countries, I think, have a real opportunity to really learn from each other over the next few weeks, so hopefully this will help you all. So the theme of this first webinar is maintaining services during a crisis and how to continue supporting people living with dementia and their carers. So we're going to start this session with a few words from Paola, and then we'll follow with we'll try and do quick introductions like we usually do, but I think we have so many people online that might take a while. But we want this session to be as interactive as possible. So I'm going to ask a few of you to speak first because I know that you have things to share. But after that, please feel free to jump in with questions or your own stories. And you can use the chat box to post anything that you feel like sharing as well. So I'll just hand over to Paola. I think Paola is online. Can I just ask you to mute yourselves just to make this a little easier for everyone. So you have a mute button next to your name, so you can click on that. I'll try and do it as we go along as well. But that will avoid the background noise. So thank you so much. Paola, are you there?
Yes, I am here. Thank you very much, everybody. I was looking at the names of those who are online. I can see Norio, Chacha, so I can see Japan, Argentina, Canada, Malaysia, South Africa, Iran, China, Russia, Australia, Holland, Zimbabwe, Taiwan. I think never before it has been so clear to me that the need for global coordination is needed here, because this is a problem, probably for the first time in our life, that is completely and utterly in everybody's face, and it's global. The idea for these webinars has come in part because at ADI we've realized that, in part because we were so aware of it in January when we had to cancel our conference and our friends in Asia were having such a terrible time, we were very aware that our constituency is the one which is mostly affected by this virus. And there are issues around it, issues around stigma that are coming up quite powerfully, but there are also issues about practical decisions that some of the doctors have to make. Last week, DY sent us an incredibly moving message from our colleague, Michelle Lacan in the Philippines, who is not with us today, I don't think, because she is incredibly busy trying to save lives in Manila's hospital. And many of our doctors, many of our friends, many of our members have reported issues of all kinds. And lately, we've also started looking at different things. The fact that some of our members, being reliant on governmental funding for the provision of services, not only have had to interrupt those services and their helplines, and therefore all the vulnerable people in their care are now not getting any assistance, but also their same nature, their same survival may be in jeopardy because of the lack of funding. So we thought it is really important, more than anything else, that at this very difficult moment in time, we pull together as a community. I really cannot thank Huali enough for her fantastic presentation. I think it's well surpassed the 5,000 views globally, which for an academic presentation in a few days is quite extraordinary, and just demonstrates to all of us that desperate need of information sharing. And our colleagues in Asia have been there already fighting this for 3 months and have got more experience than anyone else, so they can help us plan ahead better. We have collected on our website a whole host of resources, and many of you have contributed really interesting material, both on community initiatives, on clinical care, on all kind of aspects really of the COVID pandemic. So please continue to send this information. We curate it and upload it on the website for everybody to access it. We have made these webinars members only for the time being. We are aware that there is a lot of interest and more people want to come online. However, technically, it could be quite a challenge if all of a sudden we got thousands of people logging in. And we're trying to make sure that members also have a safe space where they can discuss their own personal organizational issues in freedom without feeling any pressure and feeling that they can share whatever they want. However, later we may make them more available as we are aware that quite a lot of people worldwide are watching us and are trying to get some form of reassurance and obviously technical advice about what to do. So I thank you very much for being here. Some of you very late at night, some of you very early in the morning. And I thank you so much for everything that you're doing and for everything that will come. And now I will pass it back to Laura. Thank you.
Thank you so much, Paola. So it's quite difficult to keep up with all the people online, but I have seen that Li Yu is online. Li Yu, do you want to start and share your story? I'll just try and unmute you. Just give me a second.
Ezra?
Ah, perfect.
Yes,
Brilliant.
I'm here. May I share on PowerPoint?
You can
on
try.
one
I don't know
page?
if it will work, but maybe try.
Let me try. But because you have a you share PowerPoint, so I cannot
yes,
share
at
the same time.
There we go.
Okay.
Can you try now?
Okay, let me try. Yes. Can you see?
Brilliant. Perfect. That works. Thank you.
Okay. I share what we have done until now. At the beginning, we developed a guideline for people with dementia, for the professional caregiver, because we think that we help all the caregivers, professional caregivers, then they can help more people with dementia and family carer. So we developed the guideline on February 21st, and we revise it and then translate into English to share with everybody. And the other thing is we share the guideline in Taiwan through the social media and the press release to share with the media. And because we use a lot of social media to share information, as soon as we get the new information about COVID-19, we share through Facebook or Line, WhatsApp, WhatsApp. So the official infection prevention measure from our government, we will share this information and ask our caregiver not to watch the television all the day because it will increase the level of anxiety. So just ask them to get the information from us. We will give them the information, the update information frequently. And because we have many carers from other countries, so we share the information in different language also. And the other thing is the caregivers say that because people with dementia, they resist to wear the face mask. So we share some creative way to help the people with dementia to wear the face mask. I don't know. I know in many countries, actually, the government did not encourage people to wear the face mask. But in Taiwan, we have the face mask delivered by the government through the drug stores. So we can get the face mask regularly, for example, 2 to 5 face masks every week. And now we are making a video of interactive exercise program, because many activity were turned down. So people with dementia need to stay at home for many days. Then you know, sometimes people with dementia feel so boring. They want to go out, but actually more risk to go out to use the public transportation. So the caregiver have the difficulty to keep people with dementia to stay at home. So we make a video of interactive exercise program, and it was shared through the social media. So many people with dementia and family caregiver can use this exercise program. We also advise caregiver to do some activity in their house. And some of the groups, they use the, for example, Zoom or Line or WhatsApp to interact with people with dementia and the family caregiver. So now we have online dementia advisory group and online meeting with caregiver to understand their difficulties. And some of the people with dementia and caregiver, they have difficulty to find the resources. For example, the face masks or alcohol. Actually, we think that the alcohol spray is quite useful, because when people with dementia need to go out, but they touch something, then they do not have the, they cannot wash hands immediately. Then they can use the alcohol spray to clean their hands. Then that will decrease the risk to get the infection. So this is something we have done until now. Thank you, Flora.
Thank you so much, Lee. That was really helpful. Thank you. Do you mind? I don't know if I can stop sharing the screen. Do you mind stop?
Yes. Okay.
Sharing?
Okay.
Thank you so much. I've also seen that Francis and Jegmu from Singapore on the line. Do you want to share your experience and especially the government's support with your services? Francis? Is Francis on the line? Sorry, that it's very difficult to unmute people. So if you can unmute yourself, that would be really helpful.
Okay, I just unmuted myself. I think I have another colleague, Stephen, as well.
Yes.
But okay, anyway, we have a very proactive Ministry of Health, if I can say that. So while we have the government measures across the board, we also have instructions coming in from the Ministry of Health for the healthcare providers. But we also have instructions coming from the Ministry of Social and Family. So it's really quite a lot of information, quite overwhelming. So like what Lee said, we also try to filter out key information to the families that we support. With regards to creating activities due to the social distancing arrangement in Singapore, we have started what we call live stream. We run a program called...
Sorry, just muted someone.
We run a program called Memories Cafe, which normally is held in actual cafes around Singapore, but now that's not possible. So we know that the social interaction bit is no longer possible, but at least the activity bit was something we decided we could try. So we did the live stream because during the live stream, our colleagues are still able to communicate with the families who are participating via WhatsApp or via directly. We are using our YouTube channel, ADA YouTube channel, so directly they can also give comments or via WhatsApp. And this gives them a form of ongoing live interaction. After that, after the 1 hour or so session, we upload this on our YouTube channel, but it's quite interesting to see that the video is viewed more times during the weekday than during the live stream session. So it's a good thing. It means that the families continue to use this video even after the live stream. So it's also helped us to realize that we should continue this even after the outbreak is stabilized or is no longer there. So yeah, we're going to have live sessions, but at the same time, why not have the video session, the upload on the video sessions? What else? I think we're following the government guidelines. The daycare centers are still running, but we've seen maybe 30-40% drop in the dementia daycare centers. Our caregiver support group sessions we have stopped, but we are still in contact with the families through the phone, through WhatsApp. Our dementia helpline is still running, and we are now running in split teams. So to ensure that we're trying to mitigate any cross-infection. So ADA can still run regardless of anyone getting infected, because we are essentially running in 2 teams now. That's a pain. I think for people who are running split team, I can tell you, you can understand what I mean. It's really a pain, but I think it's a necessity. Okay.
Thank you so much, Francis. Thanks for sharing with the rest of us. I see that Lorraine from France Alzheimer is on the line. Lorraine, I know that you also had things to share with us. I'll just unmute you now.
Yes, me too.
Hi,
Thank you.
Lorraine.
Can you hear me?
Yes, we can. Yeah.
Yes, okay. Thank you very much. Yes, so maybe I will start with what we did at the association, because we have in France we have 99 local organizations, and of course they had to stop all the activities and support activities they were running. But what they did almost everywhere is that they started a support, psychological support on the phone. So they gave access and information on their website on how to reach them to get psychological support. And at the federation, we tried to give as much information as we could on our website, mainly informations about how to deal with anxiety, raising anxiety for people with dementia, especially when you are at home. And also we receive a lot of testimonies about how it is going on inside nursing homes, because right now the government, how do you say, I'm sorry, stopped the visits for the families in the nursing homes. So we have a lot of ethical issues raising from that, mainly for the end of life issues. So we are trying to work on this with other associations. It's a strong issue, and we are a little bit lost on this one, because of course we have to respect the government's measures, but we also have to deal with a lot of testimonies. And we are also working on giving the possibility to the caregivers to stop working when they couldn't before, and they had to still go to work and they can't work at home. So we are trying to give them access to a new governmental information that they can stop working and they will still be paid. So, well, I think we deal also with a lot of isolation issues at home and at nursing homes, trying to give information to the people on how to still be connected with your family and your family. Thank you.
Thank you so much, Lauren. Thank you. Can I call on Patricia or Amalia to talk about what they're doing in Indonesia and the Netherlands? Can you unmute yourselves? Let me just unmute Amalia. There we go. And who else is on the line from Indonesia?
I think maybe Patty can start from Indonesia, and I will add on from the Indonesians.
Perfect, thank you.
Yeah. Okay. Hello, everyone. To share about our Alzheimer's Indonesia initiative during this COVID-19 outbreaks, just to give you a quick update. As of now, the our governments is still trying to manage to prevent more outbreaks, as each and every day more cases coming up. And we in Alzheimer's Indonesia, all our initiatives is to stop all our offline events and then move towards the online events. As one of our online initiatives were initiated by the first one by our board member, Dr. Yuda. So we have this online education sessions, a webinar for all our chapters leaders across Indonesia and also abroad. And we also have these TV talk shows on COVID-19 prevention, key messages by one of our geriatricians who support also ALZI. And then we produced several infographics of COVID-19 key messages about social distancing, and we posted it on our social media to really provide support for people with dementia and the family caregivers, which also led by Jyoti. And our next plan for this coming weeks are we trying to make our events online, such as the caregivers meeting, a counseling session. We also planning to get more resources and more materials so we can update our community on really how to stay healthy and then stay safe in this kind of situation. So I guess this is a quick update from us, Alzheimer's Indonesia. And then Amalia, would you please also share your initiatives in the Netherlands?
Yes, maybe I will share about Alzheimer's Indonesia in the Netherlands is for the minority groups, which is in Indonesians in the Netherlands. So, of course, in the Netherlands, we are now having a lot of components, the ministry, the local government, universities, researchers, home care, and nursing home. They really have all their, of course, there is a basic guidelines from the governments, but the government giving the local authorities to imply the basic regulations to their regions, because now in the Netherlands, every region doesn't have the same level of the COVID-19 penetrations. So, well, we are in a push and pull activity now, because we have a lot of activity, but along the way, of course, the news and the progress of do's and don'ts is also progressing. So now we are also, like you see before in the posters, now we have, that's the one who's the safest one. We also working together with the local community and also Red Cross, because they are helping the elderly too. So we are now helping the elderly with their basic social needs, like groceries, walking the dogs, or asking to buy something and something like that. We plan to send them cards, supporting cards or Indonesian food, something like that. But again, now it's also a risk. Even sending, they are trying to tell us not to sending supporting cards now in the Netherlands because they don't know what's in it and da 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 da. So we stopped the actions, and now we just helping if there is an especially Indonesian elderly in the Netherlands who need help. And we are also collaborating with the Indonesian students, which is not returning to their home yet, and they decide to stay here and they want to do something. So the students also collaborate with us. So that's so far from Indonesians in the Netherlands.
Thank you so much, Amalia.
A quick additional from me, Laura. So joining also this webinar is some of our chapters coordinators from Alzheimer's Indonesia. So they also in each of, because Indonesia is a big country with thousands of islands. So each of the chapters coordinators has their own initiatives, like Amalia in the Netherlands, or there's also some our chapters leaders who volunteering in distributing mass surgical gown for those who need. So this is during the situation, we in Alzheimer's Indonesia is a very there's a lot of initiatives going on across Indonesia to really help our community, especially the elderly and our caregivers. So yeah,
it's quite incredible to see how coordinated you are all over the different islands. Thanks for sharing that. I know that we have quite a few other members on the line. We have quite a few from Latin America with Chacha, Panama. Do you have anything to share with us from your countries? Chacha, do you want to say a word? Let me see if I can unmute you. No. Chacha, are you there? I can't seem to unmute you. We've also got, oh, Chacha? No. So Farineh also from Iran. Oh, Chacha, are you there?
Yes, okay.
Do you want to share?
What we had done here, well, here in America Latina, we are just beginning with this problem so we are very active, the associations. I know we will have a new meeting with you in Spanish with everybody. We are 20 associations in America Latina. So we are working very hard. It's just the beginning here, only 2 weeks. And we have, for instance, isolation obligatory in some countries. And we are trying to prepare our teams because it's not easy for us. And we are preparing more in this time. All we said the administrative problems we have with people in our organizations, volunteers, and people. We are the most of the people is volunteers. So we are working at home. We are organization this kind of working, but each organization in each country are working very hard, and the contacts with people, carers, and with people with dementia, we are just beginning to prepare this because we have the government measures of prevention are beginning. They are in my country, in Argentina. It's very important, the work that is in general for the country. We have not many time we are beginning with this, with very hard work now.
Yeah. Thank you, Chacha. And as you said, we will be circulating the recording and some bullet points in Spanish. And for the next webinars, we will also have sessions in Spanish. So
thank you very much.
We're not forgetting all of you in Spanish speaking. Who else do we have on the line? I believe, I know that Jan is on the line from Zimbabwe. We've got a few people from the Middle East as well. Please feel free to share your questions. We also want to hear about your challenges and what you're struggling with. I'm going to share, I think if no one wants to share right now, I also have little notes that some members have been sending me by email because they can't join this webinar. But for instance, Nori has shared what the Alzheimer's Society in the UK is doing. So they're moving face-to-face dementia advisors to deliver support over the phone, which a lot of you are doing. And also rolling out virtual singing for the brain sessions. They're also introducing companion calls, which is a brand new initiative where trained volunteers will be available for a telephone chat with someone affected by dementia who might be feeling lonely. And they're extending their Dementia Connect support line hours because actually you need that support, 24/7. And they've also created an emergency appeal on a website, and they're encouraging people to shop via Amazon Smile and choose Alzheimer's Society as their charity. So these are things that Alzheimer's Society is doing. What else? Does anyone, maybe Paul from Uganda, I just see that you've joined.
Yes, hi Laura. Hello
Hi,
everyone,
Paul.
sorry I'm late. I was just sending a message saying I've just joined.
Great. Do you want to
I
share
hope
what's going on
everyone's
in Uganda?
well as can be.
Yes.
Pardon?
Did you want to share what's going on
Pardon?
in Uganda at the moment? Hello? Oh, just lost you.
Hello? My connection keeps on going in and out.
Okay, no, I was just asking whether you wanted to share what was going on in Uganda and how you're coping with the situation at the moment.
Well, pretty much the same as everyone has gone. Uganda so far, we have, I believe as of yesterday, 9 confirmed cases.
Mm-hmm.
But we definitely don't have the testing capacity of most countries in Southeast Asia or Europe. But we do have a virus research institute because of the previous Ebola outbreaks. So in that particular respect, we have dealt with extremely dangerous epidemics. Our last Ebola outbreak had a 67% fatality rate. And the first one we had that was more than 10, quite a long time ago, is even higher. So in that respect, we have had epidemics. Otherwise, what has happened last Friday, we did get closure of all schools, all churches, mosques, all religious gatherings, weddings. Funerals are allowed, but with very limited number of people. We don't have a complete lockdown, but we do have restricted movement. Perhaps I was about to say quite obviously, perhaps it's not so obvious, but in countries like ours, limiting transport, etc., we're very much a cash-based economy. So putting people on a complete lockdown can be very difficult. And to put it crudely, can be very politically dicey. It's possibly one of the reasons why a lot of our countries haven't. That said, we haven't had many cases. The amount of panic buying and things like that, it hasn't been that much, but there have been pockets of it and peaks and troughs. The worry is definitely getting higher. As far as care for the elderly, there has been nothing specific mentioned, nothing specific done, etc. And as possibly as might happen or be happening elsewhere in the world, we might get the elderly, and especially those who are suffering from dementias, falling through the cracks. The last thing we've had is that, yes, we've stopped all flights in and out of the country. That's about it.
Thank you. And how are you supporting, how are you changing your services to support people with dementia? Have you had to do that already? Or are you kind of waiting?
Sorry, could you repeat that? Laura,
Sorry.
could you repeat that?
Yes, I'm just wondering how you're changing your services to support people with dementia and their carers in Uganda, based on everything that's going on.
There hasn't been any focus on that whatsoever.
Right, so you're pretty much joining to find out a bit more. Jan, I see you've joined from Zimbabwe. Do you want to share what's going on there and how you're coping? Oh, you need to unmute yourself, Jan.
While we're waiting for Jan, could I introduce a colleague of mine called Carol? Carol, are you there? Or perhaps we can't hear her.
Yeah. Yep. Okay, we'll move on to Jan. Thanks, Paul. Thanks very much for sharing. Hi, Jan.
Hi, like Uganda, nothing has happened as yet. They're still saying that we only have 3 confirmed cases, one of whom has died, which people might have seen around the world. So that's a pretty terrible statistic. As far as Azad is concerned, we are trying to keep in touch with people through our WhatsApp groups, just communicating with them and asking them if everything's all right, how they're feeling today. So far, that's what we've done. It's a very scary situation here, though, because we just don't have the medical facilities. It was very compromised before this happened. So I just hope and pray that we don't get a huge rise in the number of people, because we just don't have the facilities. So, we're just keeping in touch with our people as much as we can and hope that each person will be able to support their neighbor in any way that they can. So, but thank you for, we're interested to see that, all the different activities that can happen and the exercise that we will be able to share with our members. Okay,
thank you so much,
good luck, everybody.
Thank you, Jan. I just got a few questions on my WhatsApp. Let me just read them out. So people are asking, how are members managing health services during COVID-19 home care? What's the other one, DY? Maybe you can unmute yourself and share that one.
Yeah, there's a question about, hello. There's a question about the experience. Is any members have the experience of person with dementia with COVID-19 positive? How do you manage them and dealing with the coordination with the government system and all that?
Please do unmute yourselves if you have anything to share regarding those questions. I also saw that Farineh was on the line from Iran. Maybe Farineh can also share what she's been going through, or anyone else. Please do unmute yourselves. Farineh, oh, yeah, I see you. Let me just unmute you. There we go. We should be hearing you now.
Hello, everyone. We have been through this for about 4 weeks now. We've stopped working. We've closed down our day center and clinic. So we're somehow maintaining what we have been doing in the past. We have the clients from the day center in a WhatsApp group, and we have categorized them in 3 categories ABC, so that they know what kind of abilities their loved ones have. And so the psychologists and a therapist, work therapist, an exercise corrective instructor, they all work on this. They put posts on the group for the group, and they have 1-hour session for questions and answers, and they train the carers to have these sessions at home with their loved ones, so they maintain their abilities and they don't sort of lose during this time. And then we have 2 doctors. We have diverted the calls, and in case of emergencies, 1 psychiatrist and 1 internist can go to homes and visit people who need services. We have a class, a free class online for carers. It's yoga and respiration, so that would relax them and sort of reduces stress of caregivers. And we have ongoing support group online as well. That what we were doing at the center, now we have arranged in a group to do it online. That's about what we do.
Thank you, Farina. I know the situation's been very tricky in Iran, so thanks for everything that you're doing there.
Well, we try our best. Money is our...
Yes, it's always the fun thing.
We're short of money. Yeah, it's very difficult.
Yeah, so if you have any ideas also regarding fundraising in these difficult times, let us know. And we can also share that later on, even if it's not on the webinar. Please do unmute yourselves if you have anything to share, or do share in the chat box. I'll just share what Ireland is doing. I don't think we have anyone from Ireland, but I might be wrong. We do have 67 people on the line. So if you're from Ireland, please unmute yourself. But they've actually put together an organizational committee to work on developing alternative supports for people, given all their services are almost closed. So once they've got those ideas sorted, I will share those with you. I'm sure Tina will be happy to share them.
Hi Laura, this is Fiona from Ireland as well.
Yeah, brilliant, there you are. Please do share with us what you've been working on if you can.
And it's fantastic to see what is happening across the globe, really, and to learn from one another. And I guess in Ireland we're in a very similar situation. All of our services have closed, and we're really looking at how can we support people with dementia and their family carers. So as you mentioned, we've formed a committee within the Alzheimer's Society, and we did a very short research project. It's just a little focus group questionnaire where we asked our clients, our people with dementia, our carers, but also local community champions who are supporting people with dementia out in the community, of what are the 3 most pressing topics that people have at the moment, and what can we within the Alzheimer's Society do to address it, or what are other resources that they have noticed in the community that already could be helpful. So based on that, we're going to put together like some information and a resource pack for carers and for people with dementia. And they include similar things that have been mentioned here. So our dementia advisors are still active, so they are still calling in by phone to people with dementia and their carers and supporting them there. They're giving advice of where is up-to-date information when it comes to COVID-19 and for vulnerable adults and what to look out for. The government has got a lot of posters, videos, hand hygiene videos, all of these things, so we can refer people to that. But at the same time, we're also compiling what are the best practice things. So whether it's for exercise, whether it's for music, for reminiscing, all of these things that people can still do at home, gardening and so on. We've also worked together with a local occupational therapist, and they have now created a booklet, and that booklet has all of those tips of how can you engage with a person at home and what are some things that you could do for different activities. And also they refer to activities such as baking or day-to-day activities that people might have difficulties with now struggling with in their home. Now we're just looking at how can that be distributed across our client base, whether it is going to be online or whether we have the opportunity to actually print it and send it out to clients as well, so that they have something in their hands.
Brilliant. Wow, you've been busy.
Yeah, and we also were linking in closely with the government. So we have a campaign on dementia from the government. And on that campaign page, of course, you know, a lot of the activities are not ongoing at the moment, but what we've done is we're putting a lot of social messages out. So we have, you know, how you can keep yourself and others safe. Again, videos on hand hygiene, but also tips for mental health and well-being. So trying to stay connected with people that way. And the next step really is storytelling. We want people to share positive stories. I think a lot of people are very scared out there. They're very worried. And we want to show that, you know, we're in this together and we're helping one another. And we have some very lovely stories of what's happening out there. So we're just collating those and we'll put those online as well.
Lovely. Thank you so much, Fiona. Just to remind you that there will be a session on positive, uplifting stories. So if you can share those stories that you've collected during that webinar, that would be wonderful.
Yeah,
I'm just going to thank you, Fiona. Thank you so much. And hi to Tina as well. So Glenn, I saw your question. Would you like to, I know that it's about discrimination. Do you want to share that with the group? I'll just unmute, yeah.
This, listening to the media in Australia and media around the world, it seems that many health systems are on the verge of not collapse, but doing very badly in handling the great numbers of people coming through. And there's quite an active debate about the ethics of what doctors do if they have to make difficult choices in providing services to older people or younger people. So I think an issue for Alzheimer's societies around the world is to keep a watch on whether there is any active discrimination against older people and people with dementia, and how those very difficult ethical decisions are being taken. I know of no cases like that in Australia at the moment, but there's certainly quite a big debate here and a concern about how access will be rationed if health services are near to collapse.
So just to come back on that, we will have a session on the 22nd of April on discrimination against elders. So we'll be digging deeper into that particular theme. But please do start thinking about that, because we would really like to hear your stories. We're conscious that in certain regions it hasn't really started yet, but it's something to be aware of, definitely. But if you have anything to share right now, please do, and unmute yourselves. I just saw that Lucy from Czech Republic shared something about what they're doing in Czech Republic. Do you want to unmute yourself and share with the group rather than posting in the chat box, Lucy? Let me just find Lucy. Hi, Lucy. Is Lucy here? Oh, sorry, it's very difficult for me to unmute people.
I'm trying. Hello.
Oh, there we go. Perfect. Hi, Lucy.
Good morning or evening to everybody. Thank you for the word. Just share some little short experience of what we have here in Czech Republic. And well, we are almost, all the country is almost under the quarantine. So the services are most likely shut down. And what we can see now when people are calling our helplines is that carers are like sad about the situation because they cannot visit their loved ones in the hospitals, and most of the hospitals, they are not open to even to bring some presents or bring some sweets or something. So we are trying to support the carers, how to communicate even with the hospitals, how to make a field for better care for the people with dementia. So, and as I wrote, we are trying to do our best. We are on the helpline, on the chats, or on the Skype, and we are trying to use this time as best as we can, supporting whoever is needing a help. I'm muting.
Thanks, Lucy.
Thank you.
Thank you so much, Lucy. I saw, just coming back to the question about if anyone had an experience with a positive, a person tested positive, if you have anything to share about that in particular. Maybe Huali from China. Huali, are you there? Can't seem to unmute Huali. Anyone else wants to share anything? Covered a lot of ground here. Maybe Gan from Malaysia, I see you're on the line. Or from Panama. Anyone? I mean, I think we've covered a lot. I'm just going to come back to New Zealand. Just let me find this email, but they have put online some very useful resources to support their branches around the country, to help them put together an emergency plan, an emergency or crisis plan, why you need an emergency plan, and it's all available to download. But most of their local organizations are set up to work from home now, and they've set up telephone contact arrangements with clients. They're in the process of setting up carer support groups on Zoom, while others are setting up closed Facebook groups for carer support. And some are also investigating how to offer education in CST remotely as well. So they've also worked through their client list and identified those most at risk over this period. And they're working with their local health authorities and other local organizations to make sure those who are at risk are not falling through the cracks. So a little bit like, you know, most of you are doing as well. But Catherine had a question, and she was wondering what options were being used to replace respite services like day programs and residential respite when these become unavailable. But yes, they are using telephone and online support to replace support groups and other things, but these don't provide respite. And she was wondering how others are tackling this issue. So if you have anything to share about that as well, whether it's on the webinar or later on in an email, please feel free to share with us your ideas. Have I missed any questions in the chat box? Please feel free to jump in at any time. I know that maybe Alexandra from Russia, do you want to share what you've been going through in Russia? You're saying that you're overwhelmed.
Hello,
Hi?
can you hear me?
Yes, we can, Sasha. Nice to see you.
Yeah, this is me, staying at home, quarantine. Actually, as you know, Altros is a very small organization. It's just 2 of us. So hearing how many things my colleagues do, here in Moscow, I actually do nothing. We have, in Moscow, elderly people can't go out. They stay in quarantine. It's a law. But actually nobody, like I see lots of people on the streets and in the park. So about the virus, we have increasing people with the virus. So actually we are waiting for the many people to have this virus during this weekend. So I don't know, like, what the situation is, but government says we have like 400 people in Moscow having COVID, but actually, where's the truth? And what we do, we canceled all our offline meetings, Alzheimer cafes in Moscow, in St. Petersburg, and in different regions, and school for caregivers, and support groups. And now I'm thinking about doing online hotline, something like that. So caregivers can talk to psychologists, to doctors, to legal experts about things. And I think it can help. And we start with Instagram, but then maybe we can do it in Zoom. But actually we have to pay experts for the consultations because they have to have time for this. And we don't have much donations, and this time the donations decreases. So yeah, last weekend I cried because this is really difficult staying here and thinking about the future of the Altros Association. It's very hard, actually.
I'm really sorry to hear that. I know that a lot of members have been saying that as well. It is a difficult time, and you know, as always, we're here to support, Sasha. So if you need to talk about anything, feel free to contact us as well.
Yeah. I was asking for psychologist help. So
yeah, noted. Yes, Liu, you said that elders and all people are afraid to go to hospital in Taiwan, and Dr. Vera shared that they have a similar situation in Indonesia. What if the people with dementia have health issues there? Is home care an option? That's also an interesting point. Do you want to share more on that? Dr. Vera, maybe? Please unmute yourselves.
Oh, hello.
Yeah.
Can you hear me?
Yes, we can. Yes.
Okay. So here's the situation. There are a lot of COVID-19 patients. The hospital staffs are overwhelmed, and we don't know how to overcome this. And they told us to they told the older patients to stay away from the hospital, but it's not that simple, because these older patients with a lot of comorbidities, and it is very difficult to get the home care service for them, where they have to pay out of their pocket to for this home care service. So for older people, it's very difficult. And then the other thing, if old people with dementia, it's even more difficult. So I think I will be interested in hearing what you guys doing with this dementia people in your country. Thank you.
Thanks, Dr. Vera. Thank you. Does anyone want to respond to that? No? Please do share in the chat box. I'm trying to keep up. Yes? Who is that? Sorry?
I don't have, yes, Paul.
Yeah.
I don't have a response per se to what Dr. Vera said, but with respect to countries like Uganda, and I don't know what the situation is, for example, in Zimbabwe, but we have a situation where the stigma around like dementia is very high. It's not only the social stigmas that the rest of the world might experience, but the stigmas around accusations of witchcraft and things like that. So there's an expectation. I'm relating this to what you'd asked earlier, Glenn. I have an expectation that with that stigma, and then with COVID-19, coronavirus infections, etc., coming in, we are probably going to find ourselves in a situation where families that have elderly people or people with dementias who have been affected as well by coronavirus are simply not going to turn up at the health services for healthcare. The other thing that we do find, which is interesting in our society, is age is very much respected. However, the flip side is when situations like this happens, we revert to a default to, well, you've done your part, you've lived your life. I mean, you don't really count at the moment. So even though we don't have any specific examples, we do have a very high risk of the age and those who have dementia not only falling through the cracks being widened for them, so to speak. That's just sharing what I perceive as a possibility in Uganda. Thank you.
Thanks, Paul. Yes, and that will probably be a problem in a lot of countries, unfortunately. We really need to address that. So as I said, we'll be having a webinar and dig deeper into that particular theme. But a lot of people, sorry?
Sorry, can I also share a few words?
Yes,
from
please do.
Slovenian part? Actually, one lady put a question in the group chat about discrimination for persons with dementia. But when speaking of this discrimination here in our country, for example, Slovenian authorities took care that all vulnerable groups, meaning like pregnant women, people with chronic condition, people with disabilities, are on priority list to buy essential food supply very first in the morning. So they actually define basic time frame from 8 a.m. to 10 a.m. at shops. And we also have to do a lot and connect with local communities even more. So we even more activate Red Cross, National Volunteers Initiative, who buy food or bring medicines on behalf of people with dementia who lives at home. So and later on they put the shopping bag or medicine at the front door. So I think this is very good example how to help those people in this unpleasant situation.
Absolutely, Alenka. I know that these are things that are happening in France as well, and probably a lot of European countries.
When now I have a word, if I may add a few things more. In Slovenia, it's actually the situation about the coronavirus the same. So most of our country is under lockdown, but I think that our National Alzheimer Association is doing a very good job, because we are in touch with all national Alzheimer organizations. So thanks to ADI, Alzheimer Europe, and other organizations worldwide, meaning Alzheimer Scotland, Alzheimer Australia, who share many useful leaflets and information how to face, especially self-isolation, how to spend the day at home. So I think according to this, we prepared many information leaflets for 3 different groups, and we split them. There are some basic guidelines how to spend day fully, how persons with dementia living alone can spend the day, how persons with dementia in nursing home can spend the day, or when persons with dementia and family living together. Actually, we also post guidelines on our website, our social media. And the last thing I would like to share with all of you is that now it's a very great opportunity to disseminate, I think, all the great results from different projects that are ongoing on worldwide, because from our part, we were involved in very different successful projects, and results from this project were very interactive platform, and very useful materials that can actually help persons with dementia or their carers, if they live together, with information, how to stay active, so how to take care for cognitive training, and how to deal with anxiety, depression, and so on. So I think that's most of it, but actually we are very active as other national organizations, and we are in constant touch with persons with dementia, and also our companions who regularly visit persons with dementia at home before the COVID outbreak. They call persons with dementia every other day just to make sure they feel all right, give them hope for our future. I hope I was not too long. So
no, not at all. Thank you so much for sharing. It's always great to hear from all of you and see what's going on in each country, but I see a lot of similarities in what you're doing, which is great. Thank you, Alenka. Huali, I see you're back on the line. Do you want to come in now? I'll just unmute you. Oh, there we go.
Yeah. Yeah, thank you very much. Actually, I have learned a lot from the other organizations. I was away for a few minutes, so sorry for being...
I think I called on you when you were away. I'm so sorry.
Yeah. And I think that in addition to my presentation, I have another 2 comments that might be useful. First, because this time in China, our National Health Commission is quite responsive to the mental health issues. So we integrate our suggestions and recommendations into the national guidance. So I think that this will be more powerful. So in this way, actually we integrate dementia and old adults care. So this is more powerful. because we noticed that even in Wuhan, there is no real data about how many people with dementia are detected as positive. Because when in emergency, usually the doctors pay attention to the health situation, but they do not pay attention to the cognitive problems. So they might not have very good record about the diagnosis of dementia. But we understand that definitely there are, because a lot of my colleagues in different places, they supported Wuhan. And then whenever they get some challenges, they brought the questions to us, and we help them how to manage those difficult situations. For example, manage behaviors, manage delirium. So I think that trying to integrate with the national policy guidance, that would be helpful and be more powerful. Second is trying to bring more the efforts from different organizations. I understand that Alzheimer's Association in different countries are quite active in promoting or advocating for dementia, but dementia is not the only case for those who are affected. If we can integrate with other organizations or groups or like non-government organizations, this team can work like in a collaborative way, so that they pay attention to the health situation, to the health education, and we pay attention to more issues related to cognitive function that might make us to be more efficient. So actually this time we can act in the prompt. It is based on our previous experiences. For example, when we had earthquake several years ago, we could not act in such emergent way, because at that time we had no experiences. We don't know how to integrate with this different agencies. But within all these years, we try to integrate how we can work with them. So why this time we are quite efficient to integrate with healthcare, with physical healthcare, and also integrate with the policy. So I think that those 2 points might be helpful. So try not working independently, try to work in a collaborative way.
That's so true, Wally. Very, very true. Thank you for sharing.
Yeah.
I'm just conscious of time because we've gone over an hour already. And there was one last question that I'd like to put to all of you, which is more about the financial aspect. How do you cope with financial constraints due to service closures, but also just the fundraising issue that I think Farineh wanted to ask about in particular? Is that right, Farineh? Yeah. So if you have any stories or experiences regarding that, we'd be happy to listen to all of you and share about that. Please do unmute yourselves if you can, or share in the chat box. But as I said, for instance, Alzheimer's Society has been launching the emergency appeal. Have any other done that?
Hello.
Yeah. Hello?
I'm Effie from Indonesia.
Sorry?
Yeah, I'm
Sorry, is there
I'm Effie from Indonesia.
Oh, hi, Effie.
Hello.
Sorry, I'm
Hello.
just going to... Hello? Anyone else want to share anything? Sorry, it's very difficult to go through this list of people. We have so many people online today.
Yeah, probably I can share a little bit.
Yes, thanks, Wally.
Yeah. In our state, currently we do not have extra funding for people with dementia, because most of the funding goes to support for like facial masks, personal protection equipment. So that's why most of our work for people with dementia currently are based on our like beneficial activation. So it's non-funded. So that's our experience.
Yeah, thanks, Wally. I've also got a few notes from Hong Kong, from Maggie from Hong Kong. She's also prepared an actual presentation that I'll be sharing with the recording. But she says, in terms of the financial challenge, The association has been relying on reserve funds. Government is actually paying for some service users by community service voucher scheme as a subsidy to the family directly. However, since February, the government of Hong Kong instructed all service users to stay at home and not go out. So there's no income from this group of service users from the government. However, there is a bargaining scheme that Maggie is going to explain in her presentation. So I hope that that will be able to help you a little. But basically bargaining, with the government officials for the fixed cost, rent, staff salary, etc. So as I said, that will be shared with you along with the recording probably tomorrow morning. So bear with us. But does anyone else want to share? No? Brilliant. So before we end, I know that Annie wanted to share a few things. I'm just going to share the presentation again. Annie, do you want to come in? Okay.
Hi, everyone. It was really great to hear everyone's kind of their experiences and their tips. And from my perspective, at least, it definitely gives a sense of solidarity in the fact that obviously it might be affecting different countries and different associations differently. We are kind of united in this, and that's kind of something to hold on to, I think. So it's really good to have these conversations going. And so I just wanted to share some of the things that we have been working on and signposting. So on our website, hopefully some of you would have seen it and most of you would have seen it, but we've got a resources page. So if you just go onto the homepage, it's everywhere, you can't miss it. So some of the examples are from our membership. So Harley's presentation, which I urge you all to watch if you haven't already, because it has even more wisdom than what she shared now. We also have a video in Spanish from Daisy Acosta from Dominican Republic, and also a blog from Jackie Wong in Malaysia and how the lockdown there has affected elderly and vulnerable populations. There's also up-to-date advice, which I would urge you to look at from the WHO, preferably instead of the news, because often if you're looking at the news several times a day, you might actually not have an update each time. So it's quite useful to maybe once or twice a day check up on what the WHO has said. They also have WhatsApp alerts, which you can set up as well, and that's a useful thing to share with your kind of the people with dementia and carers that you're working with. There's also, this was as of yesterday, the WHO checks people with NCDs because obviously we know that they are the group that's most susceptible to having serious symptoms. And also, importantly, the WHO has sent out some mental health advice as well. So I would urge you all individually to have a look at this, and also to maybe share it in your networks, because we all need to make sure that we're being very, we're paying attention to our well-being, because obviously, as we've heard, it's taking a toll on people when you're trying to support others right now. We all need to be really thinking about ourselves as well. So on that note, Dementia UK has provided some calming techniques for people with living with dementia, which are useful to share. There's Ontario Neurodegenerative Disease Research guidance on social distancing, because I think it's obviously a term that's being used a lot, but sometimes there's some confusion as to what that actually entails. So it might be useful to give this one a read as well. And we have from the LTC, there's also a lot of resources on the last webpage there as well. So I just wanted to share some highlights from the page, but we also would urge people to send through to my email address, which is on the previous slide, any other resources, and we can share those on social media. And in particular, we're looking for kind of positive stories as well. And maybe the word positive is not the most apt, but kind of stories where it might give a sense of like solidarity, or, you know, people that have gone above and beyond, or where services are really being effective. And I know even from this call, we've heard quite a few of those. So if anyone would like to share those and would like them to be amplified on social media, please do reach out to us. And then just as a last question, I think this webinar has given a lot of food for thought, but we also want to make sure that the messages we're sending out as ADI and you know, things that we can provide for you so that we're all sharing similar messages are going to be the most supportive for people living with dementia and carers. And so if you have any ideas now, or maybe if you send an email afterwards about what kind of graphics you'd like to see, what kind of social media messages or even videos, if anyone has any, for example, any people living with dementia that they know would like to share their own experience, maybe of how it's disrupted their routine, or how it's, you know, how being inside has affected them personally, that would be excellent. We really want to be supporting each other with the messages that we're sending out. So if you want to hear messages about, you know, clarifying what social distancing is, if you want to hear messages about mental health support, or kind of, you know, like the uplifting stories, or anything else, please do let us know, because we want to make sure that we are supportive in our messaging as well. So thank you.
Thanks so much, Annie. Paola, do you want to say a last few words?
I just want to thank everybody. This has been an extraordinary exchange of information and an extraordinary exchange of solidarity. There are a few things that obviously have come up in the chat box that we haven't discussed yet. For example, many of you wondered whether we've had cases of people with dementia having COVID-19 and how to cope with that. We will pick them up for future webinars. One of the things that is really interesting to us is to see from you whether this has helped. Part of the reason why we want to do this is that we want us to feel the sense of being together. We can help each other, and sharing stories may not resolve our problems, but it certainly will make us grow and will make us feel that this is an issue that is involving us all, not just a few of us. Everybody's in this together, so we can grow, hopefully, as a movement. It also exposes our vulnerability at times. Our sector is the one that is most hit by this. Our sector is the one with the people with the less strong voice. There are issues of stigma. As Glenn pointed out, there are issues of human rights that we will explore in future ones. So if we keep together at least once a week, we can just come together and just outpour what we are really feeling, because this is going to be really tough for us. And if we are in it together, it's going to be less tough, and we will feel more love coming from the community. So thanks everyone. For those of you who haven't been at a webinar before and you are online now, can you please send an email to Laura so that she knows that you are interested and you want to keep connected. If you have other people in your organization, in the members of ADI that would like to join the webinars, also let Laura know, because there may be more areas and there may be for you a feeling that if more people join, they may also feel part of the community and feel a little bit stronger. I hope we have achieved that today. Thank you for your time.
Thank you so much, Paola. I'm just wondering whether we should do these weekly instead of bi-weekly. So please give me your feedback by email or via the chat box. But yeah, thank you so much for joining. It's been an incredible session. We've heard from so many of you from all around the world, and I hope this will carry on. The next webinar is on Wednesday, the 8th of April, and the theme will be mental health and well-being during self-isolation. So I'll send you more information about that one. It was in the original email, but obviously we'll send you a reminder. But yeah, if you want weekly ones, let us know and we can decide on that soon. So thank you all, and see you very soon. And all the best, and stay safe, please do. Thank you.